Hi, it's Alison here at Dentistry On The Square, and today we're going to answer some of your frequently asked questions about veneers and composite bonding. So question number one, what are veneers and dental bonding, and what's the difference between the two? So first of all, veneers and bonding will both improve the look of your teeth and make things look much nicer. Veneers are thin shells like a contact lens that cover the front surface of the tooth, and composite uses a resin that's bonded directly onto the surface of the tooth at the time of your treatment. Composite's generally done in a single visit. Veneers will take a couple of appointments and are custom made in the lab, so they look super natural and generally last much longer. The second question about veneers and composite bonding is, am I a good candidate for the treatment? So you're likely to be a good candidate if you already have healthy teeth and gums but want to just fix chips, little gaps, discoloration of the tooth, or uneven tooth shapes and sizes. So you shouldn't have any active disease, no cavities, no gum disease, and if you're grinding your teeth, that's something that we probably need to manage first. But a consultation helps us determine what's the safest and the most predictable treatment for you. So next up, the question is, how long does the process take? So we will spend some time in advance of your treatment planning out the perfect shapes and sizes of your teeth that will complement your smile and your features, and when you come in to have the treatment carried out, bonding is usually done in a single visit, and porcelain veneers typically take 2 visits, one to prepare the tooth and scan the teeth, and then one to place them after the lab have made them for you. So your timeline will depend on how many teeth you're treating and the type of material that we've chosen to use. Next is a very important question that we are asked every day at Dentistry On The Square. Will it hurt? Most people are so surprised as to how easy the treatment is when we use our pain-free techniques. Bonding usually requires little or no numbing, and veneers might need light numbing during the preparation so that things are really comfortable. Afterwards, you might have a little bit of sensitivity for a few days with cold drinks or cold air, but that typically settles really quickly, and the treatment always flies in when you watch your favourite Netflix show tucked in under a cosy blanket with us. The next question is, how long do the restorations last? So composite bonding usually lasts between 5 to 7 years with good care and regular maintenance. Porcelain veneers can last maybe 10 to 15 years or sometimes even longer. Porcelain is stronger and more stain resistant. Bonding is easier to repair, but it's maybe more likely to chip or stain or show signs of wear that little bit sooner than the ceramic will. Next, we have an extremely important question about looking after your new teeth. How do I take care of them? Care is actually really simple. Brush twice a day, clean interdentally with floss or interdental brushes, and make sure to attend regularly for your exam and hygiene appointments so we can keep an eye on things for you. Avoid biting into hard objects like ice or pens or cold chocolate from the fridge. I always say treat your teeth like jewels, not tools. If you're somebody who grinds your teeth, make sure to wear your night guard at night time. Good hygiene will always help to extend the life of your veneers and your bonding as long as possible. Next, a really important question, can I eat and drink normally? Yes, thankfully you can eat and drink as soon as the restorations are placed and you're no longer numb. With composite, you should be mindful of food and drinks that can stain, like coffee, red wine. Ceramic veneers tend to resist stains much better, and really important to avoid using your teeth to tear open packets and things like that, just to avoid the risk of chipping of the edges of either of the restorations. Next up, will I need bonding after straightening my teeth? Sometimes, yes. After orthodontic treatment, bonding can just refine the shapes, close any tiny spaces, or fix any uneven edges or areas of wear that your teeth have. Not everyone needs it, but it can be a great finishing touch to enhance your final smile results and just put the cherry on top of the cake. What happens if a veneer chips or fails? Bonding can usually repair quite easily on the same day. Porcelain veneers might need replacement if they crack or actually break off, but in most cases it doesn't weaken the tooth any further, especially if it's repaired or replaced nice and quickly. Regular checkups will help us catch issues nice and early, so just make sure that you come and see us nice and often.